51 of the Dental Realist Podcast. I am Dr. Ryder Waldron. I'm joined as usual by Dr. Troy Stevens. Troy, how's it going tonight?
Going really well. Good to be here podcasting again tonight.
After a solid day of dentistry, I'm sure. And
I had the day off, remember?
Oh, that's right. I know. I was just checking.
I know. It was a tough day for me. I went out for a bike ride this morning and then just took it kind of easy. I was going to go out and do more stuff, but it's really smoky here, so I've stayed indoors a little bit.
Yeah, it's nice and warm. We are going to be without Marks tonight, but we are joined by a very special guest. We are joined tonight by Randon Jensen, who is a practice transition consultant with CTC Associates. Randon, welcome to the Dental Realist Podcast. How are you doing tonight?
Thank you, Ryder. Excellent. It's great to be here. I appreciate the invitation.
Yeah, we're happy you can do this with us. Full disclosure before we start, I actually worked with Randon when I did my practice transition, and we don't have a lot of guests as we usually talk about on this podcast because we're very selective in who we choose to have guests on the program with us. I can't say enough about how great Randon is and his team is. So full disclosure that he did my practice transition when I purchased practice 15 years ago. Worked with him when I first got out of dental school. He helped me out with a lot of other things. So we are, just really excited to have you on tonight, Randon. So thanks for joining us. Let's get right into some questions. And this is one I think Marcus wanted us to ask when we were putting together some a question list here. Is practice ownership as a solo dentist still an attractive option for buyers?
Absolutely. And first, I want to thank you, Ryder, for the kind words. It's excellent to work with you, and it's great to work with a lot of great dentists who are doing well in dentistry and as solo practitioners, right? As solo dentist owners of their practices. So, is it still an attractive option for buyers? Is the question, and yes, that absolutely is. Now, understandably, every individual will have different objectives for their career, different things they want to accomplish, different things that they value. But I think there's still a strong demand for practice ownership. In fact, I've seen a bit of an uptick, and we'll probably get into this a little bit when we talk about how COVID's been affecting the market. But I've seen an uptick in inquiries from prospective buyers. It used to be we'd work with a lot of buyers right out of dental school, dentists coming right out of school, jump right into practice ownership. That has changed over the years, and our average buyer now is probably 2 to 5 years out of sschool, and they've been, pardon the pun, they've been cutting their teeth, in an associate position, usually with a corporate group. That's become the trend now, right? But a lot of these individuals that have been working for corporate, with the closure taking place earlier this year due to the pandemic, have decided, hey, I want to be captain of my own ship, right? I want to be master of my own destiny. And I didn't like the way the group handled the closure, and I realized I couldn't go to work unless they let me go to work. Even seeing emergencies or other things. And so I think having that sense of control is one of several things that is really appealing to dentists in terms of wanting to own their own practice. And so it is still very much an attractive option for buyers.
Yeah, that's an interesting thing because I wouldn't have thought that. I like that perspective, because you're thinking of the corporate world. We've talked about it in the past on our podcast, how corporate dentistry seems to be on the rise. And that is one huge downfall of corporate, is when, they cut. When they do that, you're the one that's going to get cut. Where solo guys or even in just ownership position, you're the one that determines if you're going to quit working or not, which is kind of interesting. I had a gentleman that we had talked to, I think it was about a year or so ago, that in our practice, he was looking to come in, maybe associate in our practice, and he just actually emailed me a couple weeks ago, said that he was working in an office, but says, how did he quote it? He said something like, things are going really well, but I'm looking for other options. And I think it's a corporate entity that he's working with over there. And I don't know exactly why you would look for other options if things were going really well. So do you see that with the people being disheartened now with some of the way corporate has handled some of this?
Oh, yeah. And the turnover in corporate dentistry among dentists, I've read different statistics, and it probably depends on the group. Some it's been as long as an 8-year average tenure before they turn over. Others, closer to 3 years. So, but I think that speaks to the fact that most dentists, not all, some really like it, and it's a good fit for them with corporate. They want to drill, fill, and go home and not worry about anything else. But common I guess complaints or grievances, maybe for lack of a better term, that I get from individuals contact me that are in positions with corporate. Not only that, I didn't like how they handled it. You brought up a great point, Troy, about, hey, the risk is I could get a pink slip at any time. Yeah, there's risk with practice ownership, but at least I have some control over the direction I'm going with the practice. And other grievances they have are, and again, not all corporate groups are created equal, and I don't want this to become a bash session. I don't intend for it to be that way. Some corporate groups do a great job with their dentists, but a lot of them will complain about, well, I'm dictated as to which suppliers I can buy from, or which labs I can use, or I really can't stand this particular employee, but I have no power to let her go. That's just outside of my control. And so those are this tip of the iceberg, right? There's a lot of other different things. They want to involve some type of technology, for example, but corporate's not willing to invest in it. And so they're left doing dentistry the way corporate, within the bounds of what they've established, the group has established for them. So I think there are a lot of those types of, like I said, lack of a better term, grievances that I hear, which then make private practice ownership all that much more appealing. Then, of course, there's the financial aspect of it, which I think is the next question you had there, if I remember right, Ryder, about the differences.
Yeah, I remember when we talked to you at a dental convention. It might have been last year, a couple of years ago, something like that, and I think Troy was talking to you about bringing in an associate or something along those lines, and you had explained the differences with the earning potential between private practice versus corporate employment. And I thought it was really interesting, and I think you can do a much better job of explaining that. So can you give our listeners a little insight into that?
Of course, absolutely. So the interesting thing is, so there have been a number of studies done on it, right? And I'm sure it wouldn't take much to do a Google search. The one that I initially read was from the McGill Hill Group, a big accounting firm back in the Carolinas that also does transitions. But a number of other studies, most of them theoretically based, but what they've done is taken, like I said, a theoretical scenario in which two different dentists are working, same number of hours, same number of days, same number of MODs, same production over a relatively short 20-year career, and have calculated the estimated earnings working, for their fixed commission through a corporate group, and taking into account the benefits that they get, right? A lot of corporate groups are able to offer maybe some health insurance or retirement benefits or other benefits, factoring all of that into it, and then estimating what that same dentist would earn as a practice owner. And over that 20-year career history, there's varies, depends again on the report or the study that you read, but they estimate anywhere from $12 to $14 million difference career earnings history.
The corporate is that much better?
No, the inverse.
I'm just joking.
Nice. Nice try.
I was throwing you a little curveball. Sorry.
Wow.
Excellent. But if you think, it stands to reason, right? Because the corporate guys, they're not dumb. They're in business to make money, and obviously, how they make money is off the work the dentist does for them. Some dentists are fine with that. They realize, hey, I'm giving up other things, and with that, I'm giving up income, and that's okay for me. But for others, they're saying, well, I'm giving up things that I don't want to give up, and I'm doing it to earn less money, which doesn't make a lot of sense for me. And understandably, I'm not entirely neutral in this. I err towards the side of the dentist. I'm probably a little bit more protective of the dentist than I should be, because understandably, that's how I make a living. And so when I see certain dentists that are taken advantage of under those scenarios, different scenarios, sometimes the big trend is now for a lot of offices to sell out to corporate groups, and corporate groups are then getting the attention of these dentists by offering them very big numbers up front, like what they would consider life-altering money in some cases, and pay huge premiums for the practice, and they're doing that to get their attention. But usually when you start looking at all the strings attached, all of the earn-out formulas and the you got to work for a certain period of time working back, and then you've got to take part of the value you're taking in equity in the parent company, those types of things. When you really start to put pen to paper and work out all the numbers, the dentist is almost always better off keeping the practice and selling it out later on at even a reasonable fair market value, rather than selling it now to this group for a premium. They almost always come out ahead financially. But I understand there's other reasons they may be selling than just the financial. But I have seen, and understandably, I'm getting calls from dentists that are disenchanted. Maybe they've done this already, and now they're trying to extricate themselves from what they've gotten themselves into, and in some cases, it's quite unfortunate. So anyway, those are some of the pros and cons. But yes, back to the original question, and maybe I've only outlined the cons, but I think there are certainly pros for dentists.
Yeah, right.
But back to the original questions, yeah, the earnings potential as a practice owner quite a bit higher. Now, some doctors will say, well, hey, this corporate group's going to take over. They're going to handle all the marketing for me. They're going to handle all the HR management and the payroll and all of these things. And I don't have to worry about that anymore. Well, first of all, most dentists come back to me and say, well, I wish that were the case. I'm still managing the practice day to day. They're really absentee owners. Again, not all groups are the same. Some are not that way. But others have said, yeah, nothing's really changed. I'm still having to do all that work. It's just now I send all my profits off to the company that owns the practice now.
Interesting. Wow.
But others have said, yeah, no, they've taken all that over. But what I didn't realize is if I could have hired the best of the best in each of those areas, like the best marketing firm, the best HR management firm, the best accounting firm, to do all of those services for me and at a fraction of the cost. Isn't that interesting? Because here's how much I'm sending in my profits, but if I'd paid all these companies to do it, it only would have cost me X, and I would still keep the difference. So
That's
a lot of them hadn't thought through a lot of that beforehand, and they're coming to me after the fact saying, well, how do I get out from under this? How do I undo this now? And in some cases we can, some cases we can't.
Yeah, that's true.
Yeah, that's really interesting.
What is the supply and demand looking like right now? That's probably a real big question for a lot of our listeners is, are we seeing people retiring, or are we in a position where, the dentists are just working until they're older and older and older and older and older, or are we actually seeing a lot of transitions going on right now?
So there have been quite a bit. There's been quite a bit of market activity, surprisingly so. I think even all during the COVID period, and maybe it was because we're not seeing patients, so let's work on other.
Think about other things, right?
Yeah, exactly.
Yeah.
Partnerships and mergers have become. There's a real trend for those. But yeah, there's still dentists that are retiring. A little bit of an uptick of dentists saying, yeah, I don't really want to go back to work with all the restrictions, with post-COVID restrictions and having to deal with those. And so I'd like to I'm ready to be done now. But not as many as I anticipated. So it really seems to be kind of business as usual. Dentists are looking to retire, relocate. There's just a little bit of everything. What we're finding, though, is there are two segments of the market that have really been affected, and it's not necessarily by COVID, it's just affected in general. We've started seeing this well before the pandemic, and that is rural areas, small towns. There are parts of the country where you can't give a practice away. There's just nobody wants to be there,
Sure.
Even though they could be great places to practice. And I've had I had an example, small town a few years ago. Dentist was collecting about 1.4 million, but had about 50% overhead. Was taking home 700,000. Decent office, had some fun toys. Had a brand new cone beam unit, did a lot of implants, so he had all the implant toys, had a centrifuge even for spinning blood platelets for healing with the implants. So he had a lot of fun stuff, but he was out kind of in the middle of nowhere where no one wanted to be. And even with a brand new cone beam unit that he just spent $200,000 on at the time, we still only appraised the practice at about $570,000, less than what he's taking home in a year.
Wow.
It took us 5 years to find a buyer, and it sold for about $390,000.
Holy smokes!
Yeah, and the buyer was from the area and hadn't even started dental school when we listed the practice. He went away, finished dental school, came back, bought the practice.
And it had been for sale the whole time.
Yeah, it had been for sale the whole time.
Man.
You know, of course, when the seller, he'd made enough money in the interim period. The money wasn't the issue. Was finding somebody that he felt good taking over, because there weren't a lot of options for patients in the area, and so they'd have to drive 2 hours to see a dentist somewhere else. So
yeah. Go on that. You said rural. What is your definition of rural? I work in an area that's about 17,000 population. We have 3 dental offices in town, 4 if you count the little pediatric kind of part-time thing that they have. One of the couple people from Boise run over here. It's a little pediatric place, but it's run by general dentist. Well, it's owned by pedodontists, but is run by general dentists. So they kind of specialize in pediatrics, I guess you could say. So, I mean, is that considered pretty rural to you? How hard would an area like that is it to sell something? Or, you know, are you talking about real rural, like, you know, 3, 4, 5,000 people?
No, great question. Well, so I have kind of an unconventional answer to whether it's rural or not. I say this a little tongue in cheek. It's whether or not somebody's wife wants to live there.
That's a great answer.
Yep.
So, and I don't mean to be sexist.
No, that's the truth.
It could be somebody's husband too, right? Either way, somebody's spouse, whether or not they want to live in the area. That's usually the defining. What I find is the defining element. So I can have small towns if they have a relatively close geographical approximation to a maybe a more desirable area or a bigger city or whatnot. Then we may not. For example, you know, Heber City or Eden or some of these other, I guess you probably have listeners from all over the country that may not know these smaller towns, but smaller mountain towns that are within 30 to 45 minutes of Salt Lake City, those there's generally still good demand for just because of their proximity, right?
Right.
But if I've got some small town in the middle of Wyoming or the middle of Nevada, you know, that's pretty remote, those are the ones that there's really just no demand for. So again, and part of it depends on how desirable they are, because some we may have a small town that's in the middle of nowhere, but it's maybe a highly desirable. Maybe it's like a resort area or something that's, you know, somebody really, there's some other appeal to or draw to or whatever. But the other area of the market I was going to mention that we're really seeing besides rural that's really been affected is smaller practices. Practices, I would say, grossing 400,000 to 500,000 or less, are the market for those is really softening, even if they're in the most desirable areas. And partly that's due to the fact that, right, the average buyer still has quite a bit of student loans. They're needing a practice that can net them after debt service probably 150 to 180,000 a year. Well, a lot of these practices after debt service aren't able to generate that much. And so that's what it means is our buyer pool, or our pool of prospective buyers, has shrunk for those particular practices. The upside is, though, that they make great merger opportunities, assuming that they're not tied into real estate or a lease. Then finding another dentist in the area, great means of expanding market share, adding patient base, adding revenue without adding corresponding overhead.
Okay, I want to ask you about that, about the merger. So is that something, say a dentist wanted to merge their practice with somebody else, do they find somebody to merge with, or is it something that you would help them find somebody to merge with, or you just, you know, finalize the agreement? What's your role in that, and how difficult is it to find somebody to merge with?
Oh, no, excellent question. So there are a couple different ways to do a merger. There's a merger acquisition where, like I was just describing, let's say we have an older doctor, smaller practice, revenues maybe have been declining, but a good patient base, a couple hundred or better patients, active patients, who's just looking to get out of practice and maybe isn't tied into real estate, meaning no lease or whatnot, then a nearby practice could acquire that practice and just move the patients over.
Okay.
Keep what equipment they want, sell off what they don't need is in the secondary market, or donate it, and then add those patients to their practice. So that's an acquisition merger. You'd be relocating a practice. Another type of merger is a partnership merger, a joint venture merger, where let's say we have two practices come together, two colleagues. They're neither one of them are near retirement. They still have a 7 to 10 year or longer horizon where they want to work, and they just want to combine their practices to get all the benefits of the partnership, right? Economies of scale and greater competitive advantage and those types of things. So those also we do several of those as well. But again, stars have to align just right. Find somebody that's near enough geographically where one of them could relocate, or unless both are relocating to a new third location. But again, it has to be close enough and not tied into real estate. And then the other challenge is you don't really have the ability to kind of court one another to determine if you're a good fit. So hopefully you've determined that in advance, because once you kind of move in with each other, it's hard to undo that.
It's like you're done. You're tied at the hip. Then it takes, pretty much litigation to get you apart, doesn't it?
Almost. In some cases, it depends.
What are we seeing as far as like the ability of these new grads and people who have been out of school maybe for 2 or 3 years that want to buy a practice? Are they having any trouble getting financial arrangements from banks? Banks, are they still being pretty good to these guys, or are they kind of being tight?
Fortunately, lenders, yeah. So the pandemic, obviously, there's been a bit of a hiccup in financing. A couple of the big name lenders that specialize in practice acquisition financing have stepped back a little bit, want to see how the portfolio is performing, want to see how dentistry is going a little bit before they jump back in. But what that's done is created kind of this opportunity in the marketplace where a lot of these lenders who have wanted to get into this space have been kind of waiting in the wings. And as there's been this vacuum created as these bigger lenders have stepped back and taken a more conservative approach, where they've jumped in and really been able to fill that void. So that's what I've been seeing happening. And so the lenders that I was working with a year ago now are I have a completely different set of lenders that I'm working with now. So some of them are still the same, but there's some newer players on the scene that are really stepping up. So fortunately, that hasn't been an issue. Lenders are looking for 3 or 4 different things. They're looking for a little bit of experience. So the days of new graduates stepping right into practice ownership, like I said, part of the reason we don't see that so much anymore is because of financing. So they want to see ideally 2 years or more, but really they just want to see the dentist's ability to produce at a level that's commensurate with the size of the practice they're purchasing. And then of course good credit rating, 700 FICO score above, a little bit of liquidity. Some lenders require 10% liquidity, meaning you just have some cash in the bank if you need to rely on it. But you don't have to use it necessarily to buy the practice, but just that you have it. And then, of course, the practice needs to cash flow and meet personal financial needs. So, there's still lending out there for buyers. The average buyer, though, like I said, generally 2 to 5 years out of school or longer. Some coming out of military commitments, others at associate positions. It just depends.
How about seller financing? Does that happen a little bit for tax reasons and tax benefits for someone who is selling their office?
Excellent question. So there is a little bit of a fallacy out there among sellers primarily, well, among buyers too, that if a seller self-finances, that there is some significant tax benefit to that. Unfortunately, there is not. Right. They can defer some of the tax, but the total tax liability they end up paying, and of course, my standard caveat, you should always consult with your CPA regarding any tax matters. But as a general rule, the total amount of tax to be paid will be the same, whether the seller self-finances it or they get all cash up front. It's just when it's paid. Okay. So not a huge advantage. So we don't see a lot of seller financing partnerships, associate buy-ins. Usually we are, and that's kind of a whole other host of reasons why we end up doing internal financing for those. But yeah, fortunately there are lenders out there still lending, and rates are great, and we're still getting approvals.
Good deal.
Yeah, that's good. So I want to talk about where some of the new graduates are going right now, because when Troy and I were in dental school, when we graduated, we had about 75 people in our graduating class. Now our dental school has kicked it up to 100, with the idea that these extra graduates would go into these rural areas to help with dentistry in rural areas, underserved populations, situations like that. But where do you see new graduates going? Are they going to big cities so they can earn money, going to, these rural areas like is being said, and getting help with their tuition or their student loan payback? Do you follow any of that, and what are you seeing?
Yes, a little. And there are those opportunities out there, but I don't hear about them as often as I would expect. And usually they're with governments like Indian Health Services, government agencies like that, that will have positions, and they're a great way to go. I just don't hear about them as often as I would expect to. So the demographic of the average dentist coming into dentistry now is changed a little bit. I'm sure it's changed from when you were in dental school. You've probably read the statistics right now. 51% of dental school enrollment are female dentists, which ironically is more in line with the rest of the world. Most other countries, dentistry is female dominated. The United States has not been that way for years until just recently, and even then it's only by the slimmest of margins. But so that demographic is changing. The report, and of course statistics, you never know, right? What do they say? Like 103% of all statistics are made up, right? Or something like that.
Exactly.
So I always take it with a grain of salt, but that I had read a few years ago was that the average tenure of a female dentist in dentistry is only 12 and a half years, which is pretty short when you consider how much work you have to go through to get through dental school, right? Versus like I think it was 27 for a male or something along those lines. So and they like the flexibility of being able to take time off. So corporate dentistry is a great mode for them, right? It's a great practice option for them. So I think that's been driving a little bit of the growth in corporate as well. I think the other thing that a lot of dental students erroneously assume, like we were just talking about with the earnings potential difference, they erroneously assume that, I have to take a corporate position because I won't be able to pay my student loans otherwise. And with student loans creeping up, they average over 300,000 now, and private schools, much more than that. A lot of them are believing that, I need to go where there's a sure thing, and I have to work here long term until I pay off student loans. And so that's another thing that's kind of driving.
But the income potential, like we talked earlier, is not supporting that.
No, right.
Yeah, it's just not. That's interesting.
Yeah. So how are you seeing? Like what I hear about corporate dentistry is a couple of things. Either you're paid based off of your production, and so you really got to crank it out, or you have a base salary, so there's possibly not a lot of motivation to crank out a lot of dentistry because you're getting paid no matter what. What are you seeing the way associates are getting paid in corporate offices versus how they get paid in a private practice? Is there a difference there?
Well, probably the biggest difference is just the profits, right? If you're a practice owner, or maybe you're asking if they're being paid as an associate in a private practice.
Associate, yeah. If say Troy and I brought in an associate to work for us, and what would be the arrangement we'd pay them versus how a corporate dentist would be paid?
Well, I see the whole spectrum, right? But probably most commonly I see in both camps is compensation based on, as you were just saying, either on adjusted production or on collections. So the more you produce or the more you generate for the practice, then the higher your compensation. and that percentage can vary depending on different parts of the country and from GPs to specialists, etc. So I see that in both areas. I do see the fixed compensation rate more commonly with corporate than I do with private practitioners, but it's not uncommon to see a private practitioner say, especially if they're working towards some type of an equity ownership, the associate is, to have them work under with a guarantee or even a draw against future compensation, which says, hey,
Okay.
I understand you may not be earning as much now, but you will be earning a lot more later as your schedule increases and as the practice grows. So I'll kind of front you the money now, and then you'll pay it back as you earn it later.
Okay.
But and you know, there's pros and cons with either one. Probably the biggest difference I see with corporate is some of the additional benefits they offer that a lot of times private practitioners aren't able to offer. But of course, if that private associateship leads to an equity ownership, then of course that's the upside that's waiting for the associate down the road.
Okay.
Do they have to pay in sweat equity, or do they take that into account when they transition into a practice? You know, when I bought my office, the gentleman that I purchased, I'm a 50-50 owner with another gentleman currently in my practice. And when I bought in, you know, I worked as an associate for a year, and then they tried, well, not they tried to, but they wanted me to pay, you know, for all my sweat equity, basically, because I increased the value of the practice, of course. We fought back and forth a little bit, and I was able to negotiate some of that off of there. What do you think of the sweat equity? Is it something that, you know, a new buyer shouldn't worry about? Oh, it's no big deal. Let's just, you know, buy the practice at whatever the value it is at the time of the sale? Or what is your take on that? Can you give us your, you know, kind of your insight on that?
Absolutely, yeah, excellent question. Especially because this is a common pitfall that I see made by associates or buyers, is not defining up front, hey, what's my time frame, what am I working towards, and what will the terms of the buy-in be, etc. So good for you, by the way, Troy, recognizing that, hey, I've contributed to the growth of the practice since I've been here, and I really shouldn't be penalized for that by having to pay a higher price.
I go in there and I make all this. I raise the practice price by $300,000-$400,000, and then I get to buy that back. You know, it didn't make any sense to me.
No, exactly. It's de-incentive, right? Let me work harder to pay more.
Yeah, it's like maybe I should have played a tank.
Yeah, there you go. But no, so you're exactly right. So what I recommend is having an appraisal done, having the practice value established right from day one or very early in the process, within what I would say the first 6 months of a courtship period, so that it's fixed and both parties know exactly what you're working towards. That way, any increase in value, the buyer isn't penalized. Because ostensibly the practice will grow, right, and grow in revenue and grow in value. And most likely that will be attributable to the associate's contributions. Now, occasionally I have sellers that bellyache. Well, yeah, but I had this latent potential that was laying there. That's true, Doc. You're going to be compensated for that in the form of the override that you earn on the associate in the interim period. Plus, if it's a 50-50, your half is still growing in value as well. And even if it's an outright sale, you're still benefiting. And usually when I sit down and show them on paper the numbers, say, okay, you can sell it here for this amount, or sell, and here's what it's valued, on the front end. Later, you're going to sell it for that same price, and the practice will have increased in value. But look at the amount of money that you've made in the interim period. We call it an override, but the profits that you've earned from the associate's work during that period of time, and almost without fail, it more than offsets any increase in value. Mm-hmm. And so I say, well, yeah, you really can't have your cake and eat it too. You can't have a higher price then and also make money from the associate in the interim period. They're the ones who contributed that latent potential into something real. But you can't put a price on potential, right? You've heard that term before. So if you could, I said, yeah, there's also the potential the practice could go into the ground. Do you want to have to pay the associate then if it does? It does?
Wow, yeah.
Exactly. That's a great point.
Well, can you walk us through how the process works here, Randon? So I say I've been, in practice for 3 years, been working at a corporate office or an associate somewhere else, and I'm ready to buy. Do I contact you directly? Do I have to find a practice first that I'd like to buy? How does the process work as far as purchasing a practice?
Yes, very good. Yeah, either way, there are a lot of options for seeking out opportunities. So a lot of the buyers we worked with, buyer and sellers, maybe half the transitions we facilitate, buyer and seller have already found each other, and they're just coming to us and asking us to put together the transition for them in a way that's fair to both sides. But otherwise, yeah, a buyer can look for opportunities, find opportunities that we may have listed or that are listed with others. Usually the process goes from start to finish. If we're looking at it from a buyer's perspective, I don't know what's more beneficial for your listeners, to look at it from that perspective or from a seller's, or
maybe we can do both.
A little bit of both?
Yeah,
absolutely.
I think that would be the most helpful. Yeah.
So a buyer may, they may be in a position. I think it's important to make sure that they have an understanding of their time frame. Things like, how much notice do I need to give to my current employer? Do I have any restrictive covenants issues I need to worry about? And then start considering, what are my personal financial needs, and start looking for a practice that's in that range. But with the understanding that sometimes smaller practices represent, we're talking about how the market has softened for those. Oftentimes those represent the best return on investment opportunities, because you can get them at a discount. Oftentimes they have a lot of, again, latent potential that you can't put a price tag on, and if you can take and build from that patient base, you can do very, very well. But knowing what you're looking for is probably the first step for the buyer, and then knowing your time frame. It's great if you can get into what we call a holding pattern, where you can then be selective as you're searching for opportunities, but have a good thing going in terms of employment. So kind of defining what you're looking for. On the flip side, for a seller, there are a number of questions to ask to determine, am I ready to sell? Usually the best answer to that is, does it feel right? Does it feel like the right time? And then determining, am I financially in a position to sell? Do I have something else to do, right? Another avocation, because your honey-do list at home is only so long, and then you're going to, once you get through with that, you're going to find that for some dentists, I no longer have a sense of purpose. Before I was getting up and doing dentistry, and I don't have that anymore. And so they kind of go through this identity crisis. So I think it's good to have, whether it's a volunteer opportunity or ecclesiastical service or other things that to occupy your time. Go on the master's tour, right? Something like that.
Yes.
There you go.
But finding that. Go ahead. Go ahead.
I didn't mean to cut you off.
No, you're good.
Okay. Well, along the same lines there, when you have, say, for example, you've got a buyer and a seller that they want to, they want to come to an agreement on a practice. What is the main things you do from there? Is it financing, appraisal, and then what order do you do those? And usually, how long from the time that you find, we have a lot of guys that are, looking at, they're either junior or senior year in dental school or whatever. When is a good time for them to start looking to get the practice transition to the point where they want to? And say someone who is 2 to 3 years out, how long does this process take once you've got a match?
Great question. So the on the buyer side, I would say start looking. And this is where it's kind of determining your time frame. If you're still in dental school, probably you're looking for associate positions, practices to buy. Not to say you can't buy right out of dental school, but there are those challenges that we were talking about earlier. But I would say as long as you're within about 6 months of your availability, in most cases, you're probably good. Meaning a seller, the transition process from start to finish, from due diligence through funding and closing, we usually plan on about 90 to 120 days. You can certainly go quicker than that, but so if you're starting to look about 60 days out, or 6 months out, about 180 days out, then you're usually in a time frame that will match with what a seller is willing to do. Of course, sellers in rural areas, they'll wait for you too, even if it's a year or two out. But
right, or
they'll
5
wait for you to finish dental school.
Yeah, you can go to 5. School and they come get out, and I'll sell you the practice, right?
Exactly. Exactly. So for sellers, probably the same thing, I would say. But now, depending on where they're located, some sellers in a rural area, I will say that, hey, 3 to 5 years out, let's start looking. Yep. Let's start looking. If that means you find somebody sooner, I would probably take that. opportunity to sell, because you may not have another one come along for 5 years.
Uh-huh.
But most dentists in most other markets, I would say probably a year out, because it can take 6 to 8 months, sometimes longer. Some of those smaller practices, even in areas that are desirable, I'm saying 2 years out to start making those plans and maybe get the practice ready to take to market, which usually then involves having it appraised, having a prospectus compiled, information that we can take then to the market, to take the practice to the market to provide to prospective buyers so that they can review it, know exactly what they're getting with the practice, and that helps us weed out those that are serious from those that are just browsing.
Right.
Cool. Well, Randon,
Awesome.
we really appreciate you joining us tonight. Can you give everyone your the way they can get in touch with you, contact you, and then also can you tell our listeners what areas CTC Associates covers?
Of course, yes. Thank you, Ryder. So I have business partners. Marie Chatterley is in Denver. She covers Colorado, most of Wyoming, and New Mexico. Then Crystal Smith is in Phoenix. She covers Arizona. And then I'm here in Utah, cover Utah, Idaho, and most of Nevada. And then we occasionally, I got this question yesterday from a dentist inquiring about a practice we have listed in Hawaii right now. He said, "Why you're in Utah? Why are you selling practices? Why in Hawaii?" And we just started working with dentists there, and they keep referring their colleagues to us, so we keep picking up listings in Hawaii. So we've got one on Kauai, by the way. If Ryder, Troy, if either of you are interested in it.
Is it a full-time deal, or is it just like a couple days a week and then you like surf the rest of the time?
Well, what I think you ought to do is you get Marcus and a couple of other guys together. You go in on it together, and then you each just take like one out of every 6 weeks or something. You go down there and work the practice, and
I like it.
And play.
Right? Now that's somewhere you could probably get your spouse to agree to go work for,
yeah, exactly.
Probably. Yeah.
Great point.
That's right. Wow. That's right. But yeah, so mostly Utah, Colorado, the surrounding states we cover. And as for my contact information, landline 801-298-4242, or of course our website, www.ctc-associates.com. That's Charlie Tango Charlie and then a hyphen, associates spelled out in plural.com. And my email is just my first name, Randon, like Brandon without the B, at that same domain.
Cool. Yeah, awesome. And like Randon mentioned, he gets a lot of referrals from dentists in Hawaii. Well, when I got out of dental school and I asked a dentist that I knew, he immediately referred me to Randon. He was the only brokerage firm, the consulting firm that I was referred to. And as far as I'm concerned, that's who I would refer everyone to. I can't stress enough how good they are. I've worked with them. Troy and I talk to them at the dental conventions quite often, and top notch, just trustworthy, honest, and just awesome. So thanks, Randon, for being with us tonight. Troy, do you have any parting words?
No, I thank you too, Randon, for your time tonight. This information is so important for people, looking to buy or sell or whatever. And it's great to have you on, and I appreciate you letting us pick your brain and giving us this information. It's just really important stuff for our profession. So thank you very much.
Thank you, Troy. Thank you, Ryder. Absolute privilege for me, an honor for me to be a guest. So thank you so much, and thank you again, Ryder, for the kind words. It's great to work with excellent dentists like yourself. Thank you.
Yeah, thanks so much. And we got to cut this short because I'm going to go talk to my wife about moving to Kauai as soon as possible. But,
that's a bad idea.
Yeah, not a bad idea. So this has been episode 51 of the Dental Realist Podcast. We appreciate you listening, and we'll talk to you on episode 52. Thanks.